Bismillahirrahmanirrahim. My name is Sudais Ahmad and I am the student of optometry. Today the topic of my presentation is black eye. What is a black eye? A black eye is something when hits your eyes, cheeks and nose and it causes a bruise that covers above and under your eye. What is its pathophysiology? A condition occurs when the blood vessels underneath the skin break without a cut on the skin. When the blood vessels break, blood leaks into the tissues under the skin and change its color. A black eye starts off red in color and then turns blue or purple, and as it heals, the black eye turns green or even yellow as the hematoma is digested or decomposed by the body. Often the swollen areas gets worse when you wake up the next morning. Most black eyes will heal in about 1 to 2 weeks, but some may take longer. Now, how to treat a black eye? It does not require any specific treatment. It gets better with time. But in order to prevent it from swelling and help it heal, we can use a cold gel pack or a bag of frozen vegetables on the injured area every 1 or 2 hours for the 15 minutes at a time for the first 24 hours. It is important to put a towel between the eyes or other cold object and the skin in order to prevent causing cold injury or a burn to the skin. Use the ice or other cold objects for at least 6 hours after the injury, but up to 24 hours. Some people do it after 2 days. There is nothing wrong with it, but it's probably not too much beneficial. You can also give acetaminophen, that includes Panadol, Tylenol, but avoid giving aspirin or ibuprofen because they can increase bleeding. Now, when should you see a doctor about a black eye? You should immediately see a doctor if you have the following symptoms. Number 1, fever, a problem with your vision, blurred vision or double vision, a very bad pain in your eyes, especially when you are looking side by side, nausea, vomiting, slow heart rate, trouble breathing through your nose. All these require emergent treatment and emergent diagnostic test to figure out that is there something wrong going out. Now, will you need any test for black eye? Well, most people don't need any test for the black eye, but the doctor might want to have a detailed eye examination. And also, if you have any problem in seeing or moving your eyes, especially when you look up or down, then we apply CT scan of your head to see any kind of orbital fractures. Most orbital fractures does not require any specific treatment. Just pain medicines, maybe some antibiotics if there is any blood in the sinus. But if the fracture is displaced or is causing swelling so that the eye cannot move side by side, those may be require IV medications for swelling or sometimes surgery. Well, that is all from this presentation. Thank you.